a number of us gathered here in the European Parliament, and there are a number of us gathered online. And so we will be looking to ensure involvement both of the people who are in this room and the people who are in other rooms elsewhere. And for our friends who are in the room, in the Parliament, there is interpretation available, English, French. Unfortunately for our friends online, the interpretation is not available, but you can type questions in the chat, and I'm sure somehow, if it's in French or English, we will manage quite easily to work out what it is. In this event, we are looking at European care systems, solidarity and sustainability, friends or foes. And it's a very, very timely event, because tomorrow we expect the European Commission to launch the much-awaited, perhaps over-anticipated, European care strategy. And that many of us, I think, in this room, hope will be an ambitious strategy that will deal with the many challenges and opportunities there are when it comes to the provision of care, the use of care, and what our demographics are telling us for the future of care. If you like to tweet, and I do, then you could use the social media hashtag EU Care Strategy for this morning's event. We have a number of speakers with us this morning, but I now have done the housekeeping, so I'm going to pass over to our host, who, as many of us have known for a number of years, is very committed to the care agenda, to the rights agenda, and to, well, frankly, the well-being of people agenda, Mrs. Sirpa Pietikäinen, who will give us her opening statement and her reflections on what the strategy could look like. Please.
Thank you so much, and thank you for joining and hosting this event here in the European Parliament, and I'm looking forward for very tight cooperation, not only today, but in the longer run, as we have had in the history. What is important is that this is actually the first care strategy that is going to come from the Commission. The first time that the Commission sets its hands this deep on the social matters and care and the right for social rights of the human beings. And it's a touchy issue with the member states. And this would have not happened without the European Parliament. We struggled here for 2 years after all the horrors what we've seen after and with the COVID-19 and the care of the elderly people in many care locations, that this is something we need to deal with. Not because of the COVID, but that COVID just revealed and disclosed all the pitfalls what we have ahead of us. And this is not even the worst what it might be in the future. Because if you look for the future, there are a lot of economic pressures, as you can hear, for the budget on EU and on member states. You need money for this and you need money for that. And always it seems, because the care is such a big lump, that it is sidelined to be squeezed down, not substantially increased. And this is the same matter almost with the health. At the same time, we in Europe are getting older and older. This is actually a good thing, because the only thing to fix it is to die young, and I guess not very many of us would like to do that, to choose that. And this is thanks for our healthcare systems, our education, our hygiene, our medication and all this. So yes, sure, we are getting older. But that means that with these two drivers, and a couple of the others, and this is the personalized care approach, we need to re-resource and revamp, replan the care system in Europe. And me and my colleagues in the European Parliament, we are totally convinced that this can't be done alone in the member states. And we need to join our forces. We need to learn from each other. and we need to create the mosaic. This doesn't mean that in the Europe we are going to tell to all of the member states that this is the amount of nurses and nursing homes you need, or per square meter, or per habitat, or whatever. But it means you need to have a certain standard. And it starts with the fact that this whole report from the Parliament starts, and according to what I know, the Commission isn't as bold on this, but I think that we should. And the first one is to recognize the challenge and to say we need to substantially invest in member state level on the care sector. This is totally inevitable. And this needs to go hand in hand with this change in structures of the care. Anyway, we need the both. And the second, I'm hoping that the Commission is very clear, the Parliament at least, and I know you are, is that we have some of the core concepts being European in EU concerning the care. The first is that it's a part of human rights and constitutional rights. All Europeans, no matter where they live, what their age, what the ethnic background, what diseases, education or whatever, have a right to good quality care. So people are not owned by member states. So it is not subsidiarity that in some places you can leave people deserted and without good services. And somewhere, if you wish, you give a good standard. The second one is, and this is the revamping of the system, you need to put the independent living and autonomy and respect of the choice of those people needing the care on the focus. And as you know, this is not always the case in member state level. Of course they say, sure, you have the choice. I tell you that here's a cup and here's the cup, and so you have a choice. Take this or that, and if none of these are pleasing for you, tampi, what can be done? I gave you a choice. The choice really means that you have an approach of building the service from below, from the needs and wishes of those ones that are in need of care. What then this means? It means 4 or 5 things. Firstly, from institutionalized care to community-based, independent living and home-based care. And this is a huge change. And we propose that the Commission shouldn't finance any new buildings of the institutionalized care in the Europe, full stop. This doesn't mean that we could or we should close the existing institutions. We are going to need them because of the growth of the population in elderly classes, and there's always going to be the people who doesn't anyone else to take care of them, and their condition requires that kind of a heavy service institutional care. But do not put your money on there. Put it on the community base, put it on the private sector, put it on informal care, on home-based and all that variety. Then the second point is that we need to recognize that we need European metering systems and targets on the care, a bit like you have in education, the Barcelona targets and others. And then those need to be open and transparent. They shouldn't be too rigid or just sort of a quantitative so that it leads to a certain type of the care. But certainly you can check some things that are people happy with the care, are they feeling good, is their health surviving in as good level as possible, are they fed and clean, and do they have a possibility to go out and all this. And then 2 other points. Another one is the fact that we really need to bring it as a mosaic. We need the public sector, we need the institutions, we need the private sector, and we need that kind of a development of a good quality private care services that are delivered at home. And I'm not going to go and dwell on the details of the care workers situation in Europe that is horrible in many places. We need to solve this, otherwise we do not get enough people there, and otherwise we do not get a good quality care. So it is where these two things meet. This means that we need the informal sector and the NGOs and whatever is the work from churches to disabled organizations or charity organizations. And we need the mixture, because if it is one-sided only public, or then if it's held only majority by the private, it's hard to challenge the quality and develop the new innovations. And so this kind of an multitude that is innovative and supportive to new forms of the services is essential, and this is where the Commission should put the money and the funds to develop these ones. And then you need, last but not least, and you know this me too, you need to have a separate informal carers program beside the care program. How you recognize the care, how you support the care, how you support the carers, and how you create the different good standards and conditions for home care. And this is urgently needed. I was astonished how alike these problems are in Italy, in Ireland or in Finland, even though you would think that the service structure is so different, and you would assume that the challenges are very different. No, it's exactly, they are alike. 70% of the people are taken care at home by informal carers, and if you don't fix this, no one is going to survive these economic pressures, what we are going to have for the public sector. And we should have started yesterday already, but by latest today to push this forward. So once again, thank you. I'm very eager to hear the presentations and to hear your views on the EU's care strategy and to continue working with you.
Thank you very much. We have a tiny little bit of time, so I wanted to perhaps ask you a question. You mentioned towards the end there about the mosaic of actors that are needed in this sector, and today our event has been hosted by two of those actors. So the independent, the mutuelles and the paritaire associations. And I just wondered how you see that particular role of both these organisations when it comes to ensuring the sustainability of long-term care, because, as you said, that it's a need for investment, and that it's not just a quick investment now. It's got to be a complete paradigm shift where investment is the norm. And how do you see the role of our organisers here today in ensuring that investment, but also the sustainability of that investment?
I think that actually you should be given a special role and a bit preferential treatment. And the reason for that is that you are in middle in a way on these structures. If you think very, very small NGOs, for example, they are not having and they are not going to have the resources to make the investment and to take care of all the recruiting and workers' conditions and development and all that. So you need resources. But then again, if it is only public, there's the question who is going to develop and challenge the existing mode. And then again, I'm in favor for private sector, but I do have a big question mark for profit social services, because if you do not have that kind of a balanced system, where that kind of a private capital is only 1/3, anyway less than the half, you can't sort of control the quality, you can't control the greediness, and we have bad examples on what happens on this side, I guess, in all over the globe. And this is the matter. Some people would go as far as to ban altogether the profit-seeking on this sector. I'm not so sure I could live the profit seeking if it is controlled, if it is small scale, and if there's the diversity. But then again, when it comes to your role, then it is you have the resources, as it is in general in economy. You have a special role on balancing the economy, and the non-profit role there is what sort of keeps the track going on right direction. And so I hope that you would be at least more than 1/3 of the services in all of our member states, and sort of a very tightly hooked and linked together.
Thank you very much. And it's that tightly linked and hooked together that I'm now going to turn to Sibylle Reichert, who is the Executive Director of AIM. And I wanted to ask Sirpa that question, because that whole question about where do we all fit and how do we hold the tension between sustainability and solidarity and the opportunities and challenges of long-term care are something that the mutuals and the paritarian institutions are very much committed to. But I'm sure you have to balance as well. So I pass over to you to tell us how you do that.
Thank you very much, Heather. Thanks a lot, Sirpa, for hosting this event. It's really an honor for us that we can do this. Also thanks to AIP, Giuseppe and Alexandra, who helped Jessica also from AIM to set this up for us. So thanks a lot for hosting and for setting this up. So as Heather said, I'm Sibylle Reichert. I'm the Executive Director of AIM. AIM is the International Association of Mutual Benefit Societies. We have members that are health mutuals, but also health insurance bodies. We are present in Europe, but also throughout the world. So we have members in Africa, the Middle East, and Latin America. So our members are actually solidarity-based, not-for-profit organizations that provide healthcare coverage to around 240 million people, as well as services relating to compulsory and/or supplementary health and social insurance. So some of our members also cover long-term care, and they play a role in its provision. So some of our members do have homes for elderly, for example. So what mutuals are striving for is to improve the access without inequalities and the quality of care, while contributing to guarantee their sustainability. But I would like to underline also that really we are solidarity-based systems, and we would also like solidarity to be the guiding principle for health and social care. So that's maybe already the answer to Heather's question. So for us, really, solidarity is the guiding principle, and it should not be either sustainability or solidarity, but both. So we are, as mutuals, part of the social economy, and this has been recognized by the European Commission, and we are actually very thankful for that, because the European Commission has underlined that they see the potential of mutuals in providing care and also offer more sustainable and people-centered provision and coverage. So, as I said, we are co-organizing this event with AIP, the European Association of Paritarian Institutions, and Alexandra is going to close the session at the end and explain what AIP is. So, the subject of today is really complex. We have heard Sirpa talking about the figures, and everybody in this room is probably, and also online, is probably aware of the aging report. We are an aging society in Europe. We are turning increasingly grey in the coming decades, and the total population of the EU is projected not only to decline over the long term, but also to experience a significant change in its age structure. So figures from Eurostat show that the population will decline by 5% between 2019 and 2070. And what is more, the working age population will experience an even stronger decrease from 265 million to 2019 to 217 million in 2070. So the old age dependency ratio is projected to increase over the long term, with less than 2 working age people for every person aged 65 and more by 2070. This causes, of course, major challenges for the sustainability, but also for the solidarity of our social protection systems, including the care systems. And in addition, and as mentioned by Sirpa, care is not only a sustainability issue, but you said in your initiative report, it's also a gender issue. And so the gender issue really also needs to be taken care in the upcoming care strategy. So carers in the formal, informal economy and in families are in the great majority women. And I must say I'm myself an informal carer, and I can tell you it's really a challenge to do that at such a distance. So the narrative of care needs to be changed. Both informal and formal carers need to be recognized for the central role that they play in our societies. We need to ensure that our care systems support gender equality, contribute to tackle health and other inequities, and above all, that they do not lead to socio-economic exclusion. And I would add that we need a lot of flexibility to be able to do that work. Okay, so it's not an easy task. So today we are long-term care. It is a pressing fiscal issue and a critical policy issue, as has been mentioned by Sirpa as well. But first of all, sustainability means nothing for us without solidarity, accessibility, and quality. Second, not only does the aging of the European population have an impact on the demand for and offer of care, but also there are other aspects such as the availability of workforce, and I think we are going to hear more from Stacey, both formal and informal, again, migration flows, and the integration of older people in societies. The care sector challenges depend on a wide range of elements that are not purely related to that sector. So we also can think about the active participation of women in the labor market, qualification, wages, and especially also the working conditions of care professions. And I think we all experienced during the pandemic that there is a huge problem or challenge to tackle, and also the retirement age. So the challenges ahead are hard to solve because of the many complex interactions that need to be taken into account. There's the need to subsidizing the demand to ensure access, and this will threaten financial sustainability. A greater reliance on home care seems at this stage to impede a higher participation of women in the labor market. Achieving better jobs and decent working conditions and better salaries for the care sector should not threaten or could threaten the affordability of care, but it should not. So how do we manage to overcome these dichotomies? How do we balance all those aspects so as to ensure universal access to solidarity-based high quality and sustainable long-term care services? These are the main questions that we will discuss today. So I thank all the panelists, Stacey from the Eurocarers, Philip from Age, Juan from AIP, and François Perle, who represents AIM here. Also thanks to Heather for moderating the panel, and I hand over to Heather without any further ado. Thank you very much.
Sibylla, thank you very much. If I could ask you just one quick question. There's the care strategy coming out tomorrow, a very well-timed event today. What would you not want to see in it that you think might be in it?
I maybe come back a little bit to what Sirpa said on the mosaic of care providers. And for us at AIM, it's really important that the role of mutuals, and I guess the same is also true for AIP, is recognized, and that we see ourselves not confronted with a bulk of private associations that are working on this. And I think that Lancet published just before the summer of the cost of for-profit. So for us, it's really important that not-for-profit organizations such as mutuals really play a major role in providing the long-term care services, and that really care is not about having such an amount of time, but really, or just to have a little amount of time to take care of somebody, but really put the human being in the center. Thank you.
Thank you very much, Sibylla. And indeed, we'll be looking, I was about to say nervously, but with anticipation as to what will be in the care strategy, because you're absolutely right. If you don't say that you are part of the mosaic, then you won't be part of the mosaic. We need to see in the care strategy that mutuals, the paritarian associations and many, many other actors will be mentioned. So thank you. Thank you very much. Just a housekeeping reminder for those of you who are online. It's been 2.5 years. Everybody knows how to use the mute button. So if you need to refresh your memory, take the opportunity now. We know accidents happen though, and distractions happen, but do remember that. We're going to turn now to our panel. As we mentioned, we have a number of speakers with us this morning, and each of them are going to just reflect on our theme for this morning of solidarity and sustainability and how to have that balance between them from their own perspectives. As mentioned, we have 4 speakers. We have José Juan Sánchez Arias, who is the financial manager of CTIP, which is one of the members of the paritarian institutions. He will then be followed by François Pell, who is chair of the working group on ageing and long-term care within AIM. Then, a familiar face maybe to many, Philippe Sereux, who is the policy manager on social protection and relationships with the European Parliament for Age Platform Europe, and also maybe well known to many, Stacey Yegemonos. I've known Stacey for about 15 years and I still can't get this right. We even talked about it this morning. But Stacey is the executive director of Eurocarers, so with a focus on informal care. And each have been given 7 minutes to speak, and we hope that at the end of that 4 times 7 minutes-ish, that there will then be the opportunity for discussion and for questions both from our online participants and for those in the European Parliament. So I will be sticking to the 7 minutes and start to give you a bit of a death stare if it's going on a bit too long. So we will try and keep to a bit of time for everybody. So if I can first start with José. And I invite you to tell us a little bit about how you see the achievement of this balance between sustainability and solidarity, even when we know there are increasing financial pressures on national budgets. We have cost of living crises, we have the war in Ukraine, we have so many demands, but at the same time, we've said here, care needs to become a priority for investment. So I'd be happy to hear your views, please.
Hello to everyone. Thank you for having invited me to this panel today. It's a pleasure to be here to talk about LTC systems. My name is José Juan Sánchez Arias, and I represent the CTIP, which is a member of AEAP, French member of AEAP. The members of my organization are managing healthcare schemes and pension funds at a company level or at industry-wide. In France, we cover around half of the workforce with healthcare, long-term care, disability or death benefit plans, but also with pension funds. Sorry. As all members of AEAP, our members our schemes are not for profit and are all managed jointly by employers and employees. And we manage around 220 billion euros of assets. So either. You asked us about the question of the sustainability of universal solidarity-based LTC system. Long-term care refers to care and support of people in a situation of dependency over the long term. These people are no longer able to assume all the acts of the daily life on their own, and this is due to their older age, illness, or disability. Well, illness and disability can occur at any age. When we talk about long-term care, we're usually talking about elderly. The rapid aging of the European population is a fact, and I will not repeat the figures that Sibyl asked previously. So this is a fact. The good news is that life expectancy will continue to increase, but yet living longer doesn't necessarily mean living healthier. The aging of population has a considerable impact on most of the aspects of the society and the economy. To the benefit that people live longer, these trends also raise important challenges for social protection systems in Europe. And more specifically, healthcare and long-term care systems risk becoming financially unsustainable as a shrinking labor force may no longer be able to provide for a growing number of older persons. This continuous increase raised the question of the financing of the aid of long-term care. And the COVID pandemic has further highlighted the challenges that aging societies bring to many healthcare and long-term care systems. So this question, while we are going through a major financial crisis, must lead us to reflect without complexes, but also to remain lucid and coherent. As I told you, our members are not-for-profit institutions, and they are actors of the private sphere. And they act in complementary of the public system. We strongly believe that we have an essential role to play through prevention actions, the support that people in a situation of dependency need, and also the access to innovative use of technology. This is to improve the long-term care quality, to easy access to them, and finally, to help informal caregivers. And this is a point I would like to focus. Employees are increasingly faced with caring for close relatives with a loss of autonomy. And our members, actors of the social protection for workforce, wish to promote through collective negotiations the emergence of appropriate responses to caregivers' employees. And this goes through promote support for family caregivers, facilitate the work-personal life balance of the caregivers, to promote caregivers leave and a caregivers leave compensation. for the family caregivers, of course, and to develop and promote preventive actions. Okay, so support, work and personal life balance, caregiver leave compensation, and preventive actions. It's a huge challenge, okay, big deal. There are many of benefits of our schemes that can contribute to an active and healthy aging. Of course, we know that preventing actions, support, the use of innovative technologies need a lot of money, and the real return is often difficult to assess. But well, and in investing on them, it's not so easy for both companies and employees. We know that. But I think it's like the climate change, you know. If you want to save our planet, we have to move forward. And for long-term care, it's the same. It's the same. At last, I think we need to work hand in hand between public systems, medical profession, and private providers. And we must work together to seek for efficiencies. State systems for large and universal action and prevention, and paritarian healthcare for more specific answer, because with employers and employees. Thank you for your attention.
Thank you very much, and very good to hear that very also specific perspective of how you see things in France and what needs to be brought in there, because as Sirpa said earlier on, there needs to be action in the member states as well as at EU level. But you also touched on what was mentioned earlier on, that we need an informal care strategy as well as a care strategy to be as focused as we need to be on the rights and the needs of the informal carers, and so that they can remain in employment, but that they also get the support that they need. And interesting that you mentioned at the very end there about the need to coordinate with medical services, because this is something, even in my own work, we have noticed quite often that the ability to have connected health and social care is still lacking in many of the member states of the EU. And there can at times be competition between the health-related services and the care-related services about who gets people for longer or gets their insurance from time to time, frankly. But maybe we come on to that in the debate. But indeed, having that integrated approach to health and social care, I hope will be something we see from the care strategy too. So thank you very much for bringing that up. I then turn to our next speaker, Francois Perle. And as I said, he is chair of the Working Group on Ageing and Long-Term Care within AIM. So I'm going to turn to you and see what your perspective is. We heard some of it already from Sibylla, but I think there's more to go into on how to ensure this sustainability and solidarity.
Thank you. To make long story short, I want to show you first what mutuals can bring to long-term care. It's not evident because there are some difference between mutuals in France, in Belgium, and in many countries, so the structure is different. So, but I will speak from my perspective, so the Belgian perspective, and say a little word about Solidaris, which is the second mutuality in Belgium, which is both a public insurer, because in Belgium the mutuals are the managing bodies of the healthcare, the compulsory healthcare insurance. But we are also service providers by bringing to all the people, so not only people who are members from Solidaris, but all the people long-term care, home care, residential service, which are a very small part of our activities, but also, and we try to bring some innovation into long-term care. And of course, we expect a lot from the European strategy, both AIM and Solidaris, I would say. And I will give you some highlights of our expectation. First expectation is solidarity. I think that solidarity is a very important European values, and I think that if solidarity is not mainstream in all strategy, it will be a big fail, because we have faced two very important crises in the previous year. First of all, the COVID, which is not over, and second, the energy crisis, which is really not over, and we are jumping into it. And I would say that both crises are showing us what the merchandising version of the solidarity can bring as danger. I would say, first of all, that we need a very strong advocacy to demerchandise the health and the long-term care. It doesn't mean that we don't need or we can bring or build partnership with private sector. Private sector has its role in solidarity, has its role, of course, in long-term care, but I would take a very small example of, and French people here can know this, this subject is the merchandising of the home care in France. We just get out of a huge scandal in France, but also in Belgium, by a book written by a journalist called Le Fossoyeur, so it means the barrier, about the merchandising and commercialization. Commercialization is a better term of long-term care institution. It's the typical danger we face if we don't have a very strong commitment into solidarity in all our mission and all our tasks. So on the concrete point of view, what means solidarity? It means, first of all, to put, and it has been said, to put human rights in the core of the strategy, because the right to have the right to have rehabilitation, to have care, to have sustainable care, affordable care, and in general to have a good living and a good aging living is a very basic human right. When the European Commission and the Council adopted the Pillar of Social Rights, I was very disappointed that the issue of rehabilitation was out of this. It was in the first documents, and then it came to the European Parliament, and I don't want to blame the European Parliament, of course, but it disappeared from the documents. And then when it goes to Gothenburg, there was no question of the issue of rehabilitation. Rehabilitation, I use it as a global, global concept, is core human rights, and I think that if the long-term care strategy, the European care strategy doesn't take it into account, it will be a second failed occasion to put it as a very important point of the agenda. Solidarity also means the enforcement of a public social protection system or non-profit social protection system. We are very open-minded of this on this issue, but I think that, like the issue of the commercialization of the healthcare system, the commercialization of the social security is a typical bad idea. So, I will also make some comparison with the energy crisis we are facing. We see, and we have seen during the COVID crisis, that the commercialization of service of general interest is not going in the good direction. And so it is a mistake that we cannot do every time we have a European strategy to try to mix commercial interest and private interest and public interest. The long-term care strategy is a general interest cause. Can play a lot of factors, of course, private sector, public sector, non-private sector, informal sector, but it needs to remain a service of general interest. Another very important point for us, of course, is the accessibility and the guarantee of access to high quality care. it's of course part of this universal social rights issue. It's very important. It should be, and it should be guaranteed like a basic human rights, because right to have to be cured, to have care is a basic right, like having access to energy, to water, to transportation. Of course, we need to put also attention for the workforce, and especially in Belgium, but I think in many countries, we are facing the workforce crisis, or a school for nurses are empty at that time. It was a very bad year for this. So there is an issue of vocation in this sector, and we need to revitalize this sector, because we need a very strong workforce, and of course a special attention to the fact that it is mainly a woman workforces. And of course the informal career, and I put like we say in French, a stone in my garden, because of course mutuals and big institutions have not enough pay attention to the issue of the informal career. So we need to put also this in a very top priority. And of course, two issues and two look like maybe less important issues, but I think they are more at least even important than the other one, is the issue of the high technology. There is a lot of technology in aging. It's good. I used to travel sometimes before the COVID crisis in Asia, and there is a lot of wonderful and accessibility, and looks like accessible technology, but we need to use technology, but we need also to take into account the fact that technology is quite unequal, and that we need to make it more equal, at least in terms of access, financial access, but also in terms of knowledge, because it remains a big problem of accessibility and knowledge in this sector. And last but not least, mental health, because we used to see rehabilitation, and will be a little bit provocative, but for many people rehabilitation means wheelchair, and I think we many issue and invisible issue, and mental health is a quite invisible issue that we need to take into account. Thank you.
Thank you very, very much. And particularly that last point on technology, I think we may come back to it in our discussion, because it is an opportunity, but it's also an expense, and another expense, and another investment. And I think that earlier on, the comment was made, it can sometimes be difficult to measure accurately, or in the way that perhaps people want it to be measured, the impact of investment in long-term care. And actually, technology is one of the areas that we need to be looking at to provide quality and autonomy, but where we may not see that impact immediately. And yet we're used with technology to seeing the impact immediately. So I think there's more to explore on that. And thank you for bringing up the whole question about the European Pillar of Social Rights, which of course the care strategy is a child of the European Pillar of Social Rights, if you like. Although I'm not sure if the Commission would see it, describe it quite in that way, but there is the question within the Pillar of Social Rights that we have action plans and we have strategies, but we need to see the implementation. And so it's very helpful to hear from you what that implementation could look like, and indeed the red threads that need to go through that implementation and action. So thank you. I also now want to turn to other partners here today. So Age Platform Europe, very active in this house, but also elsewhere and across Europe. And so you're working quite often with people who are using care services, and who also, I think, want to have more autonomy, very much on their ability, as we heard earlier on, the co-creation of care services and how they are put together. But they must also face the challenge of how is this paid for? And the thing that was said earlier on about choice, you know, everybody, yes, oh yes, you can have choice, but what's the choice between? So how do you see this question of sustainability and solidarity, and from the perspective of your members, is it possible?
The question, I reframe the question, it's not whether it is possible, but how can we make it possible? Because it needs to be possible. I'll be a little bit scholarly. I checked the definition of solidarity. Solidarity comes from solid. So it's something that you can rely on. And obviously, if the solidarity is not sustainable, then there's nothing much solid down there. It also means a community of interest. So how do we have a community of interest? We all have the same basic aspirations as human beings. We have the aspiration to decide what our life looks like, decide how we live, where we live, and to be the main actors of our lives and not having others dictate what our lives have to look like. Obviously, this to a certain degree, because we all have our external constraints, but the basic aspirations is still that we are in charge of our lives and not others. And so this holds true all across our lives, and particularly towards, well, I say now towards the end of our lives, but when we are faced with care needs, because we might be faced with care needs and go back, thanks to rehabilitation, to a more or less normal independent functioning again, and this is something which is not necessarily borne in mind. And so this unites us, this aspiration. And something that we see in long-term care and actually in other fields that are linked to aging is that many people do not want to think of their lives in older age, because we tend to focus on today. We have there's even an economic term about the preference for the present. We think of the present. We don't think of the future. And also we think of older persons in many ways as other people. It's people who are in different life stages as us. It's not us, but it actually is us. It is our future us. So we have to think about that, and this of interest lies very fundamentally. Selfishly, we are now talking about the care systems that will take care of us. Of course, they're currently taking care of our grandparents, of our parents, or other people who might have the same age but who are in need of care. We know that 1 in 5 adults at a certain point of their lives will be in need of long-term care. We also know that the need for long-term care is influenced by certain factors in terms of having more strenuous jobs, in terms of working longer, in terms of gender. There's more women than men who will need long-term care in their lives, and they will need it for longer. So it's sort of a double effect, gender disparity. And therefore, it is a real life risk. And taken together with this preference for the present that we have, we need mandatory mechanisms that make us think of that make us create this, or rather, that embody this solidarity. The question is not whether the solidarity is there, because we do have this community of interest. The question is, do we make it live or don't we make it live? Do we give the resources to this solidarity or not? So there's a little bit theoretical to come to the point that we need a universal social protection approach to long-term care, because the risks are very diverse. The risks are largely independent from how we design our lives. Obviously, we do have impact on that, but a lot of it is determined externally. And therefore, it's not something where private interest or commercial interest should break the predominance. Also, long-term care should allow our independence. I come back to this point, but in a certain way, long-term care is often thought of services who palliate for functional limitations that in a certain way limit our ability to function as biological beings, let's say. It's for people who are unable to feed themselves, people who are unable to move by themselves, it's people who are unable to wash themselves. So they palliate for these basic biological needs that we have as humans. But often long-term care services don't look beyond that. They are there to allow our functioning, but then functioning for what? Functioning for sitting in a bed, functioning for being lonely, functioning for being separated from society. That is not the meaning of long-term care. The meaning of long-term care and of the right to long-term care, which is in the pillar of social right, which is actually a basic right, is to continue functioning as a being in society, as a being with aspirations, with other rights that are interrelated, rights to education, rights to housing, to many other rights that we have proclaimed and that are interrelated. So to make this happen, we need more emphasis on home care and community-based care, as was already mentioned. But we also should not forget about residential care, because it is a reality and the reality will not go away. We also need to care for the quality of life within these residential care settings. And this we are also join what François said about commercial interest. We have seen that commercial interests try to make cost savings in fields that are linked to the basics biological functioning, rationing food or limiting the number of times that people can be washed or clothed or whatever during the scandals. And this is not what private interests should promote. If there's a role for private interest, it's not for reducing the services, but for offering more services, maybe for those who can pay for that. And obviously, we need to have basic services also there where it's not a private care provider. So we need more focus on how can we promote this quality of life once people are actually cared of, rather than only looking at this basic needs. Okay, so just to close, because also my notes close down, I come back to François' notion of rehabilitation. Actually, it shouldn't be care or rehabilitation. Care should be rehabilitation, because there is always this perspective that we go back to a certain functioning. We have some health issues, some disability, and care must help us to go back. So care in itself is rehabilitation. So actually we should turn it around and not say we need a care strategy. We need a rehabilitation strategy, and care is part of that. So thanks for that. I see I'm over time. So I'm closing here.
Thank you very much. I have to say all our speakers are being very good with their time, so it's no problem at all. I'm really touched by this notion of we are treated to function, but to function where or what or indeed why. And as somebody who comes from the provider's perspective of social services, I think that's a really challenging, really good challenging question. But we just said, oh, maybe it's a rehabilitation strategy, or maybe it's a different name, but actually it's about ensuring participation and dignity across all of life's journey. And I don't know if we can strategize that in some ways, but it comes back to what's been said over and over again, is that solidarity and rights and autonomy need to be at the centre of whatever we are doing, and both for the mutuals, for the paritarian associations, for the organisations who are here today, that's what everybody is wanting to see, is this change of paradigm that puts the solidity of solidarity actually in its place in our concept of what is Europe, in our concept of what it means to be older than you were 20 years ago, as somebody who's perhaps more concerned now about what happens. That whole concept of it, if we can make it a much more normalised conversation, a much more normalised part of our lives, then we might not face this dichotomy, as was said, between the sustainability and indeed the solidarity of our systems. So thank you for that. And we've heard already quite a lot about informal care and a few ideas of how that could be addressed at an EU level. But I really think it's for Stacey to tell us how Eurocarers see it. And Eurocarers represents organisations of informal carers and indeed many informal carers themselves. And so how are you seeing this whole question? Because the informal care is rising, and it's rising for different reasons. But how do you see informal care as being addressed by the care strategy, or do you not want it to be addressed there and see a separate strategy, as has been mentioned?
Thank you. Sorry. Thank you and good morning, everyone. Yes, we do want informal carers to be captured in the strategy, hopefully. Coming back to the overarching question, from our perspective, we all know about the growing demand for care, the growing prevalence of chronic conditions, age-related conditions, the declining supply, the sustainability and quality challenges. And as a result, as it stands, what we see is that long-term care costs tend to vary substantially across Europe. Now, from the perspective of patients and carers, what that means, is that it often reveals catastrophic for them. And as I guess our colleagues from the OECD will confirm, because this is based on their research, without social protection, a huge majority of older people with long-term care needs as a result of out-of-pocket cost would fall into poverty. Even with social protection, actually, many of them are at risk of poverty. So I think, first of all, social protection is a core component of our discussion today, and social protection, obviously, as we all know, is already based on the principle of solidarity. From the system's perspective, when we look at the different ways of financing care systems, what do we have? There is self-insurance. But self-insurance entails that individuals would have to accumulate massive life savings in order to cope with their long-term care needs. So realistically, self-insurance as a standalone model is actually unrealistic. So a preferable model is a model based on solidarity, as insurers call it, on risk pooling, to share risks and expenditure across a larger group of people. So it is a fact that solidarity works better than certainly than self-insurance as a standalone model, as I said. Now, a third model of financing, to some extent, we could approach it like that. A third important piece of the puzzle is informal care, which is intrinsically rooted in solidarity as well. It's another form of solidarity. When people cannot afford self-insurance or don't have access to any solidarity mechanism, well, they rely on the social network. They rely on their family members, friends, and neighbors. And this is the case in the majority of member states as it stands. So from our perspective, I'm very pleased to hear all of you now mention informal carers in your interventions, because I can tell you that a few years ago it was not the case. So if anything, we hope that the strategy will continue to bring informal carers out of the shadows and acknowledge their contribution to our economies and to our care systems. I hope you all know that, because this is also based on EU research, informal carers are currently the largest providers of all care in Europe. So without them, our systems would collapse. So there you go. Informal care is rooted in solidarity. Without them, our systems would collapse. You have your sustainability. Solidarity is sustainability. So what we expect from the care strategy is guidelines to member states to redistribute caregiving responsibilities between the collective and individuals. Currently, many member states, I was going to say majority of member states, tend to rely or over-rely on informal carers. So that needs to change. But at the same time, we need to acknowledge that it's going to be extremely difficult to replace informal care by professional care altogether. So we also need them to some extent involved in future care systems. And to do that, we need to define their rights and probably their obligations as well. So hopefully the strategy will serve to make progress there. I'll stop for now. Thank you.
Thank you very much, Stacey. I'm actually going to ask you a question then, because you didn't use all your time, but something you said right at the beginning, that long-term care costs vary quite dramatically across Europe. And I'm very aware that we're speaking today at least to a large part from a more Western European perspective. Maybe could you say a little bit more about the challenges you see for informal carers, perhaps in eastern parts of Europe, where the social protection systems are just not yet at the level that we might expect to see in Finland, for example. How is that looking, and how can we take that into account when we look at a care strategy and a solidarity system where there are such wide gaps between the understanding of what social protection should provide?
Yes, to put it simply, of course, we see a great diversity of context across Europe, and Eastern European countries and probably southern countries of Europe are less advanced than other parts of Europe when it comes to social protection in the field of long-term care. And as a result, informal care plays an even more central role in the provision of long-term care. Now, this is related to the design of long-term care systems, but not only. It should also be mentioned that it stems from, I suppose, cultural, ideological differences, which probably need to be addressed as well when discussing, for example, gender equality. From our perspective, it's really about we don't expect that the care strategy will impose anything on member states, but it's about creating opportunities. We need alternative options to informal care to be available to all people across Europe. And then ultimately it's up to, I suppose, families and people in need of care to decide what they prefer, But that lack of alternative options to informal care is certainly problematic across Europe, and particularly in Eastern European countries, in southern countries, yes.
Thank you. I know that we're gathered from all across Europe between our online participation and our in-house participation, but I thought it was important perhaps to acknowledge that there are differences, and it puts a greater pressure or informal care in some parts of Europe as opposed to others. So we've heard from all of our panellists now, and we'd be really keen to hear from people who are participating in this event. And so if you would like, we have the opportunity of about 35 minutes or so for questions and discussion, and that might be that you want to ask a question directly to one of our panellists or indeed to Sirpa, or it might be that you just want to reflect on your own views on what you've heard today. For those of you who are online, as we said, if you could post your questions in the chat, they will be relayed then to the panel by Jessica. So, can I invite questions? Yes, please. And if you could, when you're in the chat, if you could say who you are and what organisation you come from. And if you're speaking in the room, if you could also say who you are and what organisation you're from and who your question is to. Thank you.
Sure. My name is Klaus Niederländer, and I'm from the Active and Assisted Living Program, which is a member state initiative how to make use of digital technology for aging well. And I have a question maybe to Sirpa and Stacey, because Sirpa, in the beginning you talked about that we need to resource and revamp our system. And that because this whole mosaic, what we talked about, is simply not working. And it's from an old age, it's from an industrial age with all silos all over. So for me, the question is, because we know, how do we change that? And how do we make those who are actually concerned about this actually us all? Because I think somebody rightly said this is not just about old people who are in need of care. This concerns us all from the start of our lives, that we do something in taking care of ourselves through education and through, and so that ours, because otherwise our system will simply not be able to deal with it. So I would like to hear a little bit, how do we do that? Because member states are simply not the right level to do that. That's not where information happens, nor on a European level. And just getting some ideas, because we have been working a lot on this, and we see that we need a significant shift towards demand-driven systems, which are much more local, regional, but where there European collaboration is necessary, where we need to build a new middle ground using digital platforms for getting the right data for things, not macro data, which doesn't really help us how people really are and feel and so forth. Thank you.
Thank you very much. So I think as that was quite a specific and quite detailed question, I'll turn immediately to Sirpa and then Stacey to answer that. And then that will give the rest of you a chance to think of your question.
Thank you so much. And yes, indeed, this is the question. How do we make it? And what I'm envisaging is that if we would get all of us together, this is the mutuals, this is the trade unions, this is the private sector, this is the different NGOs, this is the patient organizations, Age Europe, and you name it. This actually would represent more than half of the Europeans. It's just the point, how do we get that kind of amalgamizing movement for people to acknowledge and to say, yes, this is our right. We need good care. I need it myself, as heard, but I need it for my parents. I need it for the other people. And yes, it is costly, but so is dying too. So put it on member state level and EU level on the political agenda, just by poor plain force the amount of discussion. Maybe we could have a European initiative, citizens' initiative about it. And how to get the elderly people, this is the trick. And as you said, I think that the problem is that people who are in their 60s, 70s and pretty well off, they don't want to think about getting old and crippled and start campaigning. At least in Finland, this has been very difficult to do. The most effective group actually has been the informal carers that are in their 40s, 50s, that are taking care of their own parents. And they realize what the problem they are in and how actually fragile the system is. Then another one that if I may, would like to put a question to you, the rest is, do we need a new kind of organizations as well? Do we need the pan-European mutual that I could be a member of and pay a certain whatever fee to guarantee to get certain of services, because so many people are living in different member states. So be I in Spain, Finland, or in Brussels, I could be provided, or my parents could be provided. Should we have on this solidarity base, a paritarian European something? And the mutuals themselves have a specific, as we discussed a lot, I think everybody is very clear on this role in economy and the solid from the solidarity. So should we have something on grips that people can join and they can support, and that is European and that is owned by people and people working there? And what do you think about this? Because there's so many other issues, not only to put it on political agenda, to make it European and to make it so strong, it is stronger than individual member states.
Thank you. I'm actually going to jump immediately to Alexandra and Sibylla to perhaps answer this, because I have some knowledge that it might actually be a desire to be able to do this, or at least have some cross-border possibilities when it comes to at least mutuelles, I understand. But there may be some difficulties with that. And obviously, we also have the Social Economy Action Plan, which is also out now, which was also expected to address some of this. But I'll start with Sibylla, Alexandra, if you want to come in, and Stacey, we will come back to you. But as this has come up now, I think it's right it comes from both of you.
So yes, I mean, AIM in the past has lobbied for a European statute of mutuals, but it failed. And it failed at the council level, because not all the countries saw the need of doing such a thing. It is important for some of our members, but not all. But I know that some of our members would really be interested to offer their services in other countries. Having an overarching mutual could be also an idea, but for that we need the European framework to do that. So we have now concentrated our lobby activities on the social economy, and we see that this is being recognized, and we really are grateful for that. But there is still no legal recognition of mutuals at European level, and that's the issue for us. And I speak under the control also of François, who is one of our members. But we were trying to achieve that, but it failed. And this is maybe also because of the shattered landscape of social protection at European level.
Should we restart the fight?
I think that some of our members would really appreciate to start the fight again.
Just before I turn to Alexandra as well, I think that there has been some discussion as well that now there has been the debate around the European Statute of Associations, which was also passed in the European Parliament, but is now languishing elsewhere. Does that open the door then to make sure that all four, I mean, it's a whole other event, this, but there is some potential there.
Yeah. Maybe, sorry, maybe one other aspect. So what we could imagine is to have like a reinforced cooperation between some of the member states who would be willing to go forward. We have this European instrument, so that can be a solution.
Alexandra, I know we haven't heard from you yet because you're going to bring everything together at the end for us, but actually on this topic, I think it'd be relevant to ask you to come in.
Thank you. Thank you very much. Well, indeed, very similar to what Sibyl said. I think indeed that there would be a lot of value of thinking a bit broader. Social protection, the delivery of social protection, it's such a national topic. We're representing paritary institutions. They're very much linked to the national policies and to the national legal environment. And everything that goes beyond the national borders is already very complex. I mean, there's not a really European framework that would support that. So I think there would be a lot of value in thinking forward and making sure we can bring this up at truly a European solution. They can address actual needs at national level that at the end are not that diverse. They're regulated by very different frameworks. But I think Philip mentioned this very well. The needs are basic. They can be addressed at the Central European level.
Thank you. And I think it also leads into another discussion in general about the portability of social rights between member states. And it's tended to look at that from an employment perspective, or indeed on child benefits, which was attempted to be done in the revision of the social... I'll not remember the exact name of it, but there has been quite a long... the transferability of social protection. But look, I know a group of us also pushed on long-term care. And then Brexit came along and there was a lot of concern of British people living in Spain, what happened to their rights, and that sort of thing. So there has been kernels of looking at this, but there is a need to go, I think, quite far deep into the portability of all forms of social protection insurances as we encourage people to move and to exercise the freedoms that the European Union gives us. After that sort of sidebar, which is a really important one, can I come back to Stacey and the question that was asked earlier on?
Yeah, thank you, Klaus. I'm not sure I have an easy answer to your question. I'll just say this. There's something that really, quite frankly, despite our kind of relative success in terms of making the issue visible of informal care, that has bugged us and continues to bug us, in every time we attend a discussion about long-term care and informal care. It is the fact that it is consistently approached from the perspective of informal care as a barrier to something else. Employment, female employment, productivity, whatever. And certainly that's part of the discussion. It's an important part of the discussion. But it's a slightly narrow focused approach to informal care. And informal care is much more than a barrier to something else. You know, as I said before, without informal care, our systems would collapse. So certainly there's much more than being able to combine work and care. I mean, again, don't get me wrong, it is part of the discussion, but it should not boil down to that. So to try and answer your question, I would say that it'd be great to see a slightly different approach to care and caring as public goods, not as means to an end, not as means to something else, but as an end in itself. And there I would build on what my colleague Philippe said in terms of dignity, human rights, the core values of the EU, solidarity, which I think need to, and I hope will, appear very clearly in the strategy. Now, when it comes to the reform and innovation in the systems, well, certainly, as we discussed already, I think together, ICT can bring a lot of potential, and certainly from the perspective of carers in terms of access to information, training, validation of skills, emancipating, so to speak, carers from their caregiving responsibilities, giving them the opportunity for remote monitoring, therefore combining work and care potentially. But innovation does not boil down to ICT. There are other ways of innovating by merging, some systems, by ensuring that health and social care work better together, by looking at the way these systems are funded. So there's much more to innovation than ICT, I'm afraid. So, yeah, that's all I can say regarding your question, at least for now. Thank you.
Thank you, Stacey. Would anybody else on the panel like to comment on like both the questions we've just been hearing? Nobody's jumping in. So can I see if we've got any questions online at the moment? Yeah, please.
There is a question from Diane Whitehouse from ETEL. So technology has been mentioned from time to time in this morning's discussions. What do the panelists aspire to see, if at all, in the European Care Strategy document regarding, for example, the use of different new technologies and/or digital mobile, both for the people themselves receiving care and for the people giving them care?
Thank you very much, Diane, and for that question. I said we'd likely come back to technology, and you've done the job for me, so that's great. So I'm going to start at this end and invite our panellists just to respond as you see on this question about what do you aspire to when it comes to technology?
Yes. Yeah, good. I'd like two things. First is evidence-based, because technology is wonderful, but it needs to be evidence-based, because and it's one typical commercialization problem is that many people are selling technology saying, oh yeah, I will bring you something wonderful with it, will change your life. And of course, I'm not against technology, on the contrary, but we need evidence-based technology. So we need technology that really helps and not that replace human, first of all, because human is very important in care, and also which is really efficient and which bring real added value in the daily life. That's the first thing I want to highlight. The second item is, of course, accessibility, because technology has a cost. It should, of course, take it into account in the budget of healthcare. If you take the business model of drugs and medicines, technology is a huge problem of sustainability, because we are now facing, in Belgium, but like in many countries, the entry of a lot of new products which can transform healthcare, but which has also a very huge cost. So the question of accessibility, which I think will be, the second very important attention point for technology. So we need technology, but we need to build it on this two-sided approach, evidence-based and accessibility.
I would add also privacy and autonomy. Technology is great and can encourage a lot of autonomy, but it can also mean surveillance, particularly in the care context. And there it is very important that the person in need for care who is eventually monitored by technology knows where this data is going, who is getting it, who is deciding what on that. And again, that it doesn't replace human interaction. It can enable human interaction. I think Skype is probably or now WhatsApp or video conferencing is one of the greatest achievements of technology in the care context in the last 10 years, from my very not subjective perspective. So it's not at all designed for this context, but it allowed people to keep in contact with their families during COVID, etc. So it was actually a huge benefit for that. But it is a technology which enables things. And I want to quote a short video which was created a couple of years ago, which is called Uninvited Guests. You can look for it. Which is about an older person who has very well-meaning children who offer him all sorts of devices. So an intelligent fork that counts how many vegetables he eats every day and whether he eats enough, an intelligent walking stick that counts the steps, and an intelligent bed that tells him when he sleeps, when he doesn't sleep, and that he doesn't sleep enough. And so he gets pretty annoyed by all these notifications telling him to say, oh, great, you ate one carrot, but please eat another cabbage. Now it's time for walking, but actually he wants to read. Now it's time for bedtime, but his book is too interesting, so he continues reading and he's not sleeping. And so in the end, he actually pays people for walking his stick, for example. So just to say that again, the ownership of technology, the ownership of the data and of what is done with it is extremely important, and it needs to be tested with actual people and actually people who are in the situation, designed and tested with them.
Thank you, Philip, and thank you for that recommendation of what to watch. In the preparation for this event, I was given a note that yes, use of technology might achieve some productivity gains, but it might not actually be the answer for everything. And I think you've highlighted some of those. And that a recent study from England found that the gains of people using telehealth, in addition to standard support and treatment, were actually small or similar to those receiving usual care. And that the total cost for the telehealth group was much higher than for the usual care group. And of course, costs are not the only factor to take into account. And in fact, both of you have not referred to cost. You've talked about the quality of and the usability and the privacy and the autonomy to give that evidence base for its use. And so as I turn to the rest of the panel, I think that's really important to bear in mind, that telehealth or the use of technology in care-related practices is not necessarily about it being cheaper. It's about, does it add to the quality of life for the people concerned? And if you have to then pay somebody to walk your walking stick, I think it's probably not. But Sirpa, you're into technology.
Yes, very much. And personally, I would like to have a chip under my skin so that when I'm memory disabled, I wouldn't be sort of forced to stay at home and someone could find me. But this is actually the point. You can't tell that everybody should have. You should have the autonomy, the decision on people themselves, either a prior to have this kind of a care testament, then to be asked, you actually can ask almost the difficult, severe dementia people what their preferences are. The second point is that the technology quite often is planned by young Caucasian engineer background, white male on their 20s, 30s. And they are used by these memory disabled around 80s ladies. And then you sort of figure out, well, they can't use it. The point is that you should have this kind of a user approach on, on planning the technology, how you touch this, what is the size, how you can design. It should be made to be tailor-made, because you can't sort of pick up and say this is an old person and this is what they need. Because no, you didn't understand. That I can believe very certainly. This is actually the point. And we know in theory an Apple can design a tablet for dog to communicate with their owner. But you can't design a good phone for 70-year-old memory disabled, uneducated woman. Why on earth? So this is where I hope the Commission could put the funds also. So let the people design, make tailor-made solutions, and it can facilitate, you know, in contacting and sort of delivering the blood samples, listening your lungs, or in many things. It never can replace a person, and I think that they are very undignifying to have this sort of hello speaking robots. I would hate to have one. Or for myself, I would throw it out of the window in 2 seconds.
Very much agree with you, Sirpa, but I think there has been research funding under previous EU programmes that has looked at robotic companions, which it makes me very sad that in Europe today we think that that might be the solution. Stacey, and then I'm going to come to Jose.
Yeah, I already said a few words about ICT, but again, from the perspective of informal carers, we know about the added value of ICT-based solutions in terms of access to information, training, recognition of skills, coordination with care professionals, remote monitoring, and so on. So there's a huge potential there. But I mean, as I tried to indicate before, we consider that given the essential role played by informal carers, support to informal carers should be universally accessible, should be a social service to informal carers as well. So obviously, we cannot relate on an Apple app or an Android app to provide support services to informal carers. It can help, it can supplement, but obviously there's always a temptation by public authorities, policymakers, and obviously the industry to say, oh, we have a solution for that, we have a new app. Try and type health in your Apple store and see what happens. You have 1,000 applications. Which one is the best? If I'm a user, how do I select the best one for my specific needs? So clearly, again, ICT is a tool in the toolbox, but we cannot answer all of the questions, all of the needs of informal carers. And then, as Heather rightly pointed out, what's the added value in terms of quality and the well-being of patients and carers at the end of the day? We are approached on a weekly basis, quite frankly, these days, by new companies who have new solutions, ICT-based solutions, when new apps and so on. But then, the question is always, how much will it cost for patients and carers? And then, can everyone afford that? I don't think so. So, yeah, probably not the best option from our perspective, quite frankly.
Last or least.
Yes, I don't know what to add. I think all have been said. Of course, technology will help, and of course, technology have a cost, and this is why we believe in the complementarity of public and private system in order to face the cost of the technology. And of course, technology will never replace human, and this is why we strongly believe in informal caregivers, and this is why we put it in our priorities to afford and support and add informal carers, which number growing. Just a figure, in France, we estimate them at 11 million of informal carers. It's a huge number.
Very much. And again, that reminder that the informal carers make up the largest number of carers in Europe. And yet there is a long way to go. And we've had proposals here about what could be done by mutuelles, by paritarian associations. So that's stage 2 of the care strategy, I'm hearing. Now, we have about 5 minutes left for this discussion. We've got 2 questions online, and I'm seeing 1, 2, 3 in the room. We'll take them all, but you have to be a short question, and ideally to a specific panel member, because we won't have time to ask everybody to speak. So I'm going to start here, then I'll take 1 online, take you, 1 online, and then person back of the room.
Thank you. Audrey Tournier from the representation of the European Social Security, French Social Security institutions. Maybe I will direct my comments in question to Sherpa. So many of you have mentioned the human interaction as crucial. And we mentioned as well the informal carers, but there is, which is as well something that has been separated from the formal carers, because the Commission is, at least expressed the fact that they wanted to work on the working condition of the carers, and that as well an issue when actually the professional don't have the time to care properly for the patient or for the people they are looking after. What can be done? So is the Parliament having already specific guidelines and vision for working condition of the carers and to push for an ambitious target on the working conditions?
Thank you very much. I'm going to take all the questions first and then turn to the panellists, but please keep your question as short as possible. Okay, so we've got 1 online.
Yes, so the question is from Katja Reuter from Social Platform, and it's to MEP Pietikäinen. So in some previous EU strategies, like the Child Guarantee, the Commission asked Member States to submit national action plans to implement the Child Guarantee. This would be essential to also be part of the care strategy so that Member States fully implement the strategy monitored by the European Commission. How likely is it, in your opinion, that the EC will include this recommendation in the care strategy for long-term care?
Thank you. I take the gentleman straightforward here.
Hello, everyone. My name is Marco, and I'm here on behalf of CCI Europe, Childhood Cancer International Europe. That is actually a single united organization that is representing views of patients, parents, and survivors in the field of childhood cancer. And as in the light of this Gold September and Childhood Cancer Awareness Month, I'd like to really address the issues of this undeserved population. And as you might know, childhood cancer is really a rare disease, and it is #1 cause of death by disease in children over age of 1. And unfortunately, we have huge issues with parents who play actually a fundamental role in the care journey of these patients, and as well survivors who do experience adverse effects really long-term wise, to say so, mentally and as well physically, and require some support. And there has been many good points raised here by lots of you, and my question would be addressed to MEP Serpa, if possible, in the way of will there be any synergy map down between the ongoing EU care strategy and cancer plan, for example, and other relevant cancer initiatives, to say so, that would be addressing as well the needs of such populations and vulnerable groups like rare disease patients. Thank you.
Thank you. We will also have a networking session over lunch after this. So again, I really ask that you keep your question to being a question. And online, we have another one.
Yes, actually, it's more of a comment. So about the need to consider gender diversity and oldest-hold also as issues when thinking of reshaping the care strategy.
Thank you. A good reminder on the gender dimension, both in informal and formal care. And I had somebody... Yes, please.
Yes, hello, Diana representing SECOP, European Confederation of Industry and Service Cooperatives, and our members provide care services to more than 5 million Europeans. So my question actually goes to Sirpa Pietikäinen. After the report which has been adopted in July, I wanted to ask what would be the future steps if the European Parliament is planning to continue work on different care-related issues, including innovation and so on. Thank you.
Pardon. Sorry, I'm going to close that round of questions and comments now. Please, all the panellists, don't be offended that the large majority of them have gone to Sirpa, but I think we've taken advantage that she has been with us for the whole of this session. And as one of the on the Parliament's report, that it is a good opportunity to have this dialogue with her. So, Sirpa, all the questions finally were to you, and I now turn to you maybe to give a short answer, and then we'll come to our next speaker, who will be speaking and giving some input from the OECD.
Well, thank you, and I think it is the right place to put the questions. Politicians are always the fault and responsible of everything, because you vote us to do the job, and you can't vote the mutual or others to be responsible for everything. Okay, first, the carers and workers. I hope that we could at some point have a separate issue and with European workers' associations, and maybe ETUC also, not only ETUC, because it is a pan-global issue, to think about what we can do here. And it is the working conditions, it is the recruitment, it is the education, that it is not lucrative, it is the costs, and it's a huge bulk, and it is very, very well represented on the Parliament's position, not in detail because it's a so huge bulk, but certainly I think that we are going to have a separate report or initiative on this side, because this is falling on hands. Then national action plans, well, I see it very likely both that the Commission proposed it, soon we'll see, but also that they emerge, because if you remember European Alzheimer's program, there was the same structure. And out of 27, in 25 countries, we did have better or worse, but anyway, the national program. So this is one way of being effective. Then the cancer, well, very important point, and especially for young and children, the right to be forgotten, and the other rare diseases and others. And we struggled with regress when we made the report, because there are so many avenues. There are the children, there are the elderly, there are the handicapped, there are mental illnesses, there are cancers. That do we mention everything? And if we do, then what do we sort of put apart? But thank you. I think that it would be good to have a concrete proposal from your side, and sort of the next steps on the cancer plan that you know is ready already, but it's developing. Then what else? Gender dimension, I just cut it short. If the majority of, if this is 1/3 of our public costs, and majority of the people working on this side are women, and majority of the customers are women, and informally carers are women. If this is not a gender issue, I just wonder what is. So this is the starting point.
Thank you very much. Just speaking about gender, and members of this House who've been involved in gender work before, I'm delighted that Mrs. Frances Fitzgerald, MEP, has joined us from Ireland, and I know that in the past and in the present you've been very active at looking at gender dimensions of a number of issues, as well as looking at primary care topics. Would you like to comment on anything that you've heard since you've been able to join us, if you wish?
Good afternoon, everybody, or good morning, and thank you very much. Well, I'm obviously just catching very a small part of the debate. But just to congratulate Sirpa and all of you in being involved today, because I think it's really critical, and that we do whatever we can to get greater political focus across Europe on this area. Still, as I was listening, I was still a bit concerned. You will find people arguing that this is a member state competence and, you know, what it of the EU, which sounds a very basic thing to say, but I think it's something, it ties in a little bit with the observation about the member states' action plans and whether they will have them and, you know, how competent they will be around that and how they will be monitored. So it'll be very interesting to see if that's in the strategy, and I think it's really very important. I mean, I think there's an opportunity at the moment in terms of the huge gaps in terms of personnel in care across Europe and, of course, the working conditions and so on. But there is a huge need in Europe for us to look at this area. And I think the awareness of that, I still don't think it's as high outside of those who, you know, really know the area. It isn't as high as it should be, I think, across Europe. I mean, certainly speaking for, you know, what I've observed so far, I still think we have quite a big job to do politically in terms of getting attention on this area. And I'm thrilled that there is a care strategy being announced. So I see that as a huge opportunity for all of us to really, you know, re-emphasize what we've been saying in this area and to accelerate the interest in it. But I think Sirpa will agree with me. It's if our own political group, whatever. It's not that easy to get the kind of political support I'd like to see. A bit like childcare was at the beginning, and childcare is still, you know, an ongoing issue in many member states. So. As I say, I think this is an opportunity to accelerate it as much as possible, to do as many press releases, to call on member states, you know, to really, I'm very grateful to Ursula von der Leyen for doing this and for the Commission, you know, putting it in, she putting it into the State of the Union address. So they're just some general comments on it, but I think it's a good, it's a good opportunity, but really so much work to be done to get that acceptance across Europe about how much we need to do in this area. It's a bit ironic given the need, because the need is so enormous in all our member states, but there's almost like a denial, I think, because it's to do with care and, of course, to gender, because most of the care has been done by women traditionally anyway. Thank you.
Thank you very much. And indeed, that's a summary of a number of the topics that where we started from, also this less awareness of the needs and indeed the struggles with care in Europe at the moment. But I am also aware that we are joined by Anna-Lena Nazal, Senior Economist with the OECD, who is going to give us a short reaction to what she's heard today from their perspective as the OECD. And I'm not seeing her in the room. Is she online? She's online, yeah, that's what I thought. So.
Thank you. Thank you for inviting me to this event. It's been a lot of discussion. It's hard to add much to this, but I would say there's been a lot of discussion about this concern for sustainability and how to fund care for the aging population. And I think from the OECD perspective, it's important to keep the perspective of what is the alternative. So we are talking about how to pay for long-term care, but the question is, like, what if nothing is being done? Because we know from many countries that there are enormous costs actually to the healthcare system in terms of hospitalizations of people who unfortunately cannot afford other type of care. So thinking about the overall cost is important in terms of health, but also in terms of society. We've discussed a lot of the informal carers, and there is also an impact of societal cost. By not acting, there are costs in terms of foregone labor, in terms of the health impact of informal carers that also need to be taken into account. So thinking in terms of that is important. The other item is that there's a lot of discussion in terms of the sustainability of how to pay for this. In terms of we're going to have less and less working age people, and it's very hard to put more pressure on working age people to finance this via social contributions, via taxes. So thinking about other alternatives here. We see that certain countries that have set on an insurance system, they've also looked at older people to finance part of the cost. That's also an important item to keep in mind, but also thinking about other forms of taxation. But I think also the debate today was about other type of partnerships that can be created. Currently, there's very little room for private insurance, with few exceptions in some countries. But there's also been countries that had a mandatory insurance and then taking by private insurance. Also, there is discussion of the mutual funds, what role they could be taking into this for the funding. Also, what is quite important in this is that as much as we strive towards having universal long-term care, as we've had universal health care, so far this is not the road that countries have taken. There's an element of cost sharing in all countries that varies, but perhaps what could also be recommended is how can we also limit the amount of cost sharing? Could there be a cap? Could there also be better safety nets for those who are on low income? Because currently the thresholds for exemptions and for the safety nets are very low and they miss many people. It would also be important to consider the discussion on housing that has also been very debated in a number of countries, because in essence, we have also the same problem. We're asking people to use their housing to finance long-term care, but this has implications for their relatives who are still living with them. So can we also build financial solutions for this? Which are currently very underdeveloped in terms of reverse mortgages. Could we also rethink the thresholds that are actually making that people who have relatively low assets and even the middle class is actually suffering from this and target more, again, the higher end of the distribution? So that is one part. The other part that has also been very much debated today is the issue of the workers. And there, again, I think there's been a lot of discussion because of the COVID crisis and a lot of awareness, but there's definitely room to rethink of the link between the workers and quality. And sure, investing in the workforce is also a cost, but again, thinking of what is the alternative, because many providers are actually having a large share of cost just because of the turnover, because many people are leaving the workforce and they have to replace them. So by investing in the working conditions, they would also reduce those costs. And finally, in terms of the discussion of informal carers, currently the only thing that has been done at the European level in terms of their support is being in terms of the leave, but this falls very much short of the needs of carers who also need respite care, they need training, and beyond the leave, there's the issue of flexibility at work. So I think those are also important elements of the debate to ensure the sustainability of the carers, both from the formal and the informal part. Since we're running out of time, I will stop here. It's been a pleasure.
Thank you very much. And I think you reacted very well to the many topics that have come up this morning. And I think all of us will look forward to perhaps trying to find some of the answers to some of the questions you posed around financing with the OECD in the coming months. But I would like to turn now to our final speaker, who has the job of trying to wrap everything that has come out this morning into some sort of whole. And Alexandra Kadeskaya, who is the Executive Director of the European Association of Paritarian Institutions, will give us some conclusions and close our meeting.
Thank you. Thank you, Heather. Thank you very much. It's really a pleasure to take the floor after our distinguished speakers and to close the inspiring discussion we had this morning. I would like to start by thanking Ms. Sirpa Petikainen for hosting this event. That was really much appreciated. I would like to thank all the speakers for the very insightful and inspiring contributions. I would like to thank our moderator for leading and steering the discussion today, Ms. Nozal from the OECD, for her participation and for providing comments. Most importantly, I would like to thank everybody who joined us physically in the room or online. And last but not least, I would like to thank our partners and the co-hosts and co-organizers of this event, the International Association of Mutual Benefit Societies, AAM, Sibyl and Jessica, and also my colleague Giuseppe for taking care of organizing this event. After my first remarks, I would like to introduce AAP a little bit. So, in the European Association of Paritary Institutions, which is a Brussels-based advocacy organization presenting social protection providers, which are managed and established on equal basis between employers and trade unions on the basis of collective agreements. Paritary institutions, we believe, can help in implementing policy solutions for providing social protection and are key for the development of new approaches in the provision of adequate occupational health care and long-term benefits, as well as in the management of work-life balance for workers. In this context, our members that are paritary healthcare insurers or provident institutions are very much interested in the European care strategy, especially in relation to loss of autonomy, informal care, or healthy aging. As you know, and I think it was stressed many times today, tomorrow the European Commission will publish its communication on the European care strategy, and the Council of the EU in its formal EPSCO meeting on 8th of December will publish its recommendations on long-term care. And we very much hope, actually, that today's discussion would provide some inputs and would provide contributions, and it would be taken into account in the future legislative steps. And most of all, that occupational and private funds would be seen as valid alternatives to healthcare and long-term care coverage by decision makers. Indeed, we strongly believe that both the paritarian model and mutual benefit societies would be seen as pillars, as partners, to guarantee inclusive and sustainable social protection and ensure high quality and affordable healthcare. Both my organization, AIP, and AIM took the chance and took the occasion of this event to push forward also some key points within their individual positions, and we hope that those will be taken into account in the future legislative steps on long-term care. And just to mention a few of those, we definitely see the need to set up a permanent group to serve as an institutionalized platform that would address the long-term care issue at the European level. We see the need for the development of comparable indicators and data that would ensure that member states can develop better evidence-based policies. We see the need for the development of minimum quality requirements for long-term care providers that will help member states ensure, monitor, and assess whether long-term care at national level is provided according to the right standard. We would like to see better support and proper recognition for informal providers, for informal care, and we would like to see the risks entailed by the informal provision of long-term care addressed also at national level. And last but not least, we would like to see better guaranteed universal access to long-term care at the national level. These and other crucial points were already included by the FEM and EMPO Committee report of the European Parliament, published in July, of which Ms. Pietikainen was a co-rapporteur, and I would like to take the chance also to congratulate you and your team on the great work done on this report. Following the publication of this very comprehensive document, AIP, AAM, H Platform, Eurodiaconia, and Eurocarers, together with 17 other stakeholders, published a letter, and it's available, I believe, on all our websites, on the topic, urging the responsible commissioners to take into account the key points from the report in drafting the EU Care Strategy Communication, and I guess we're about to see tomorrow if that would be the case. We very much hope so indeed. We take this as a very positive signal from a vast array of stakeholders, let's say, about the interest, the engagement, the willingness to take part and to contribute to the further and the next policy steps on long-term care, and for participating in this legislative process, as well as in the implementation of the long-term assessment and the complementing future-related initiatives on long-term care. With this last remark, again, I would like to thank all of you for joining us, especially to our speakers, participants online and here in the room. And I'm looking forward to the next opportunities to advance this very important discussion in the future. So thank you very much again. And I give now the floor to Ms. Pietikäinen again for some final remarks.
Well, thank you, and thank you for your summary and ideas, and of course, kind words. I just would like to say three things. First of all, thank you for putting all your efforts behind the good care, good quality care in Europe. And I hope that we'll continue to work on this even with the broader shoulders with civil society, with Parliament, and hopefully with national organizations. Count that you have quite a number of friends here in the European Parliament. And secondly, thank you for all of you participants here who have participated actively, and of course then on the line, and hope to see you too in the next events and working for better care in Europe. So this was the end of this meeting, but not the end of the work. This is just the beginning of it. Have a nice day.
And just a thank you to our interpreters who have been with us this morning as well.
We are now, if I may, we are now going to ASP 3D, Le Grand Café de l'Europe, because we are having a lunch, a networking lunch. If you want to join, you are welcome.